You look a bit worried.
Has anyone mentioned anything to you about his heart?
No.
My gut feeling, going on how Tyson's heart sounds and feels, is a patent ductus arteriosus, a PDA.
Can it be fixed?
I don't know. Hello.
Hi, how
you must be Melissa?
Yes.
This is Tyson.
Tyson.
Oh, Tyson. I was warned that he was cute.
He's cute.
Melissa is fostering 3-month-old rescue dog Tyson,
Oh, all right, come on through.
but hasn't decided yet whether she's going to keep him.
Hey, little buddy. He looks reasonably lively, but he just does look a little bit skinny. What's that? Oh, is that the spot, is it? So, Sinazo is obviously just a temporary thing. You two aren't bonding at all?
No, not at all. No, he's beautiful, and the kids love him too. You look a bit worried.
Has anyone mentioned anything to you about his heart?
No.
So his heart isn't doing a normal lupped up like that. It's actually, it's whooshing. And if you put your fingers here, you feel that? Like a little vibration?
Yeah.
So my gut feeling, going on how Tyson's heart sounds and feels, is a patent ductus arteriosus, a PDA. And if this is a PDA and Tyson doesn't have heart surgery, this condition will eventually weaken him and kill him.
Can it be fixed?
I don't know. You're having all this fun with a puppy and then all of a sudden, bang, everything changes.
You're scaring me.
Can I ask you, is this going to affect whether you're going to actually keep him?
I'll keep him now. I can't send him back if there's something wrong.
Yeah?
Yeah.
I'll make a phone call and see if I can get him into our specialist
Okay.
up at Sash.
Okay.
You've got to remember that Melissa hasn't actually formally adopted Tyson yet. So for her to face this crisis and face up to it and go, yep, I'm going to stick with him, that's really something.
Right, Squirt, let's put you up here.
Oh, you're very, very tiny on this big table.
It's very tiny. It's very quiet too.
Oh, my goodness.
Perfect.
At Sash, vets Darren Foster and Lisa Chimes are about to give Tyson an ultrasound to find out if Chris's grim diagnosis is correct.
And there it is. Wow, so you can see this dramatic flash of colour going from the left-hand side to the right side. No doubt at all that this is a PDA. I'm afraid for little Tyson, he's going to have some major heart surgery to try and fix him. Poor little kid.
It's basically an abnormal vessel between their aorta and their pulmonary artery, and all humans and animals have that vessel when they're in the womb, but when they're born it's supposed to close off within the first few days of life. And in Tyson's case that vessel hasn't closed off and you've got blood basically shunting backwards in the heart.
PDAs will eventually cause him to go into heart failure if they're not treated.
But he's going to be okay. Can you fix it?
Well, Andrew's here.
Surgeon Andrew Marchewski will be performing the extremely delicate operation.
What do you actually need to do?
We're going to have to go into his chest, so we're going to make a cut on in between his ribs and sort of open him right up, so we'll have the heart sitting there pounding away at us, and then you get a pair of forceps and get round behind it and then tie some suture around it. Unfortunately, there's a risk involved with it. The shunt itself, or the abnormal vessel, is quite thin-walled, and there is a risk that we can rupture it.
There's no way I'll give him up now. There's no way. He's here to stay. Getting really nervous now. I know, it's going to be sad.
Rescue puppy Tyson is returning to Sash for his life-saving heart surgery. This family were only supposed to be looking after him for 1 week.
Hi, Melissa.
How you going?
All right, got everybody here today.
Everybody's here today to say goodbye.
Oh, well, not goodbye.
Not, we'll just good
See
luck.
you later.
Yeah, see you later. See you soon.
Has he grown a bit?
Now, despite the operation costing thousands of dollars, they have decided to keep him.
Say bye to Tyson. Say bye. Beautiful Tyson.
I'm really, really nervous for him, because he's so little.
It's sort of like a bit of a time bomb. He could just suddenly die of heart failure at any moment. They're in the chest. I just have to push some lungs out of the way. If I put my finger on it, I can feel it vibrating. And that's just because the blood's going in the wrong direction. So we've just got to get round this little bugger and get him tied off. I've just dissected down the front and back end of the shunt, and that's easy enough to see. Now I'm going to be going around the back end of it, which I can't see, so I'm going to be doing by feel. And if ever anything's going to go wrong, it's during this bit. So they're not going to talk for a while now. It's always a bit tense. It's you're dissecting blind around the other side, and you're doing it all by feel.
At SASH, Tyson's life is in Andrew's hands. The surgeon must now tie off the abnormal vessel that's causing the rescue puppy's deadly heart murmur. This is where the smallest slip can be fatal.
You've got to be really careful, really patient, really gentle, because if you start pushing it a little bit and you're in the wrong spot, it's a disaster if you push through the blood vessel, and they just die. Whew. There's that sigh of relief. So just tying this off now, you can see his blood pressure changes and that reverberation in his heart's just disappeared. So he's a cure.
Despite the great result, it will still take Tyson several days to recover.
And it's funny, I mean, you look at the published risks of mortality are 2%, but it's just the fact that it's the complication in the surgery is death. It's a big complication.
He's crazy. We want to keep him, but we're so happy to send him home looking so bright and happy.
4 days after his operation, Tyson's heart has the all clear and the popular puppy is heading home.
Come on, Tyson, it's time to go home. Good boy. Come on. Come on, walk out. I know. That's it. Oh, it's a good boy. Come on.
Hello! Hello! Hey! It's a puppy.
Thank you so much.
No, that's a pleasure.
Hey, you want to come home? You want to come home?
At the end of the day, we've got a happy dog, happy owner, happy surgeon. It just doesn't get better than that.
If you guys loved that video, great. Make sure you subscribe to our YouTube channel below. That way. That way.